Hey everyone, Dr. Mike here. Today we're going to talk about something that might not be on your radar, but it's incredibly important. We're diving into the topic of syphilis. I know it sounds like something from a history book, but believe me, it's still very much around today. Syphilis is a sexually transmitted infection, or STI, caused by a type of bacteria called Treponema pallidum. This tiny organism is a spirochete, which means it's shaped like a corkscrew. This unique shape helps it burrow into tissues and travel throughout your body, which is a key reason it can cause problems in so many different places, from your skin to your brain. So how do people get syphilis? It's almost always spread through direct contact with a syphilis sore during sexual activity. These sores can appear on or around the genitals, in the vagina, on the anus, in the rectum, on the lips, and in the mouth. This means it can be passed through vaginal sex, through anal sex, or through oral sex. It's important to understand that you can get syphilis from someone who doesn't even know they have it. The sores are often painless and can be hidden in places that are hard to see, making it easy to transmit the infection without realizing it. This is why open communication with partners and regular testing are so vital for your health. Another crucial way syphilis can be transmitted is from a pregnant person to their unborn baby. This is called congenital syphilis, and it can have devastating consequences for the newborn, including serious health problems or even death. This is why prenatal care is so critical. Screening for syphilis is a standard part of prenatal checkups in many places, and for good reason. Treating the infection during pregnancy can prevent it from being passed on to the baby. It highlights just how serious this infection can be, and why we need to take it seriously, not just for ourselves but for the next generation as well. The good news is that syphilis is curable, especially when it's caught early. A simple course of antibiotics, usually penicillin, can wipe out the infection completely. However, the challenge lies in recognizing it in the first place. The symptoms can be tricky and can mimic many other conditions, which is why it's often called the great imitator. It can hide in plain sight for years, quietly causing damage without you knowing. That's why we're going to break down the signs, especially a surprising one that many people and even some doctors might miss: a headache. Let's get into it. When we think about the early stages of syphilis, the first thing that usually comes to mind is the chancre. This is the primary symptom, and it typically appears where the bacteria first entered your body. It's small, firm, round, and usually painless. Because it doesn't hurt, it's very easy to overlook, especially if it's located somewhere you can't easily see, like inside the rectum or on the cervix. This sore will usually show up anywhere from 3 weeks to 3 months after exposure. Even without treatment, this sore will heal and go away on its own in about 3 to 6 weeks. But that doesn't mean the infection is gone. After the initial sore heals, the infection moves into its second stage. This is where the symptoms can become much more varied and confusing.